All right, here we go. Last but not least, in our journey through the nervous system. Last but not least, we get to our spinal nerves. We have covered cranial nerves already. Those 12 nerves that come directly from your brain, right? On old Olympus' towering top, a Finn von German viewed all hops, right? Remember, this is our little acronym you could use, or a mnemonic you could use to know the names of those guys. Do we need to write it here? What's our first? On old Olympus' towering top, Finn von German viewed all hops. What do we start with? Olfactory. This is one. Shh. The ones on the review sheet are the ones you have to know the functions for. You need to know all of them, though. You do. Yes, ma'am. The review sheet is just simply the functions you have to know. Olfactory. What's number 2? Optic. By the way, what is olfactory's? It's sensory for smell, right? Though I guess there's not really much motor for smell. If you wiggle your nose, that's, I don't know. Okay. Number 2 is optic. Oh, she's got the nose wiggle. Okay. Oh. Oh, very good. Optic. Shh. Number 2, optic. What is optic's function? Sensory for vision, right? Number 3 is oculomotor. Shh. Friends, please, I need you to stay with me. Oculomotor, what is oculomotor's function? Motor for vision. So optic is sensory. Oculomotor is motor for vision. Number 4 is trochlear, which you don't have to know, right? Number 5 is trigeminal, which you also do not have to know, correct? Because the next one we have to know is facial.
Question about number 5.
Uh-huh.
The chart 9.6.
Yep.
It says trigeminal, ophthalmic division.
Right. You don't have to know the divisions.
Okay.
Yep. Just the name. Shh. Number 6 is abducens. Again, do not have to know the function of that one. 7 is facial. And that is sensory for the tongue, motor for the face. That's on one of the mixed nerves. Remember, there's a lot of mixed nerves there. V, a Finn von German used to be A, but now it's vestibular. Vestibular cochlear. So it's this both vestibular system, which is balance, cochlear, which is hearing, right? So that is sensory for hearing and balance. Okay. Shh. Number 9, the G, glossal. Pharyngeal. I don't think I spelled that one right. Shh. Glossus meaning what? Tongue, right? Pharyngeal meaning the pharynx, the back part of your throat. Number 10, the V, the vagus. Vagus nerve, that is one you need to know. Shh, friends, please. And again, vagus does a bunch of stuff, but I said autonomic to the heart. That's the piece I wanted you to glean from that. It does do a bunch of autonomic pieces to the digestive system and lots of other places, but we're pulling just the autonomic to the heart. Number 11 is accessory. And last but not least, the last H for number 12, hypogloss. Ooh. And again, that is motor for the tongue. Okay? So we've already talked about these cranial nerves. And again, the point of them is they come right out of the brain, directly out. They don't go through the spinal cord. They don't go through the brain stems. They may come off the brain stems, but they don't go through that normal pathways. So today we're talking about spinal nerves. You're already a bit familiar with these guys because we talked about them when we were dealing with the vertebral column. But these are the mixed nerves, sensory and motor, that come off of the spinal cord. And they come off in pairs, one on each side, right? And they have a sensory part and a motor part that come off in these same little pairs. And you can see that we group them on your sheet that I gave to you. It shows you that we group them basically in three groups: cervical nerves, thoracic nerves, and lumbar, just like the vertebrae, right? You also have sacral and coccygeal nerves. We label them C for cervical, T for thoracic, L for lumbar, right? Do you remember how many cervical vertebrae there were? Not 6, close. Not 5. Not 8. 7. Good, all the way around it, right? Good. 7. Yes, 7 cervical vertebrae, 7 bones, but there's actually 8 cervical nerves. Okay? Because again, remember, you're going in between the different bones, right? Got it. It's actually one below the last one. So there's nothing. On the very top is where the skull and the C1 meet. So, but there are 8 cervical nerves. Do you remember how many thoracic vertebrae there were? There's 12. Same number of thoracic nerves. And how many lumbar? Do you remember how many lumbar there were? There were 5. Okay? So those numbers match up. It's just that cervical, you get 8. Okay? And again, the anterior root, well, let's show you the picture. I guess I don't show the picture there. That anterior is the ventral, that's the motor. The posterior is a dorsal, that is the sensory. So friends, that would be a nice multiple choice kind of question, right? Or a nice fill in the blank. There are how many cervical nerves? And you will say 8. Good. There are how many thoracic nerves? You will say 12. That was your chance, Eric. And how many lumbar nerves? And you will say 5. Good. Spanish should be okay. And again, the sacral and coccygeal, there are, like if you look at the picture, there are actually sacral and coccygeal nerves that do come out. S1 through 5. It varies, to be honest. Some people have more sacral nerves, some people have less. Some people have no coxal nerves. It just depends on the person. Because they're very small little openings. Well, these would be control. I mean, the nerves would just come from other places rather than just those intimate spots. But that's talking about, that's all like the muscles of your pelvic floor. Which is unfortunate because we didn't do that, you and I together. You realize, you remember, right, that our hip, even though we don't use the hip bones, our pelvis, thank you. The pelvis is open in the middle, like it's hollow. There's nothing. So why don't your organs just fall to the ground? It's because of this muscle, basically a little basket that holds everything in there. It's called your pelvic floor. That's what they call it. These are the muscles that, if you have incontinence issues, incontinence means use the bathroom and you don't mean to. Incontinence. Incontinence. Yes, it's all right. If you can't control that, oftentimes it's because of those muscles, weaknesses in those muscles. Shh. Sorry? Well, okay, Crohn's is different, and that's an actual intestinal issue. that you just have this diarrhea consistently. It's real pain. Crohn's disease. Yeah. That's a digestive issue. I'm speaking more of like urinary incontinence. You laugh and you go to the bathroom kind of thing. Oh, yeah, it happens. It happens. You should not. This is one of the. I guess I should mention this to you, friends. Okay, I gotta find you the picture now, because now since we're diving into it. Muscles were chapter 7 or 8. 8. Well, let's go back here. Let's go to images. Okay, give me 1 second. All right, so I'm speaking about this right here. This is your pelvic floor. These are those muscles. Shh. And it basically, and we'll talk about this way much more in the future, but you know that basically a fetus starts off as neither male nor female, and then as they grow, they differentiate, right? And some of the reasons why you have folks who are transgender or these kind of things is they don't completely differentiate, or maybe they get both, or there's lots of variations to that. But the muscles are the same. That's the point that I'm trying to make to you. The muscles are the same. And these are what control, again, urinary continence, bladder continence, bowel continence, all these kinds of things. Yeah. So those are the muscles. But the point I was going to make was that there are many people, and guys probably don't know much about this because we don't hear about these things, but there are many people who think that, oh, I just laughed because, and I had a little bit of a leak, a little bit of urine that came out, and that's totally normal. It's not. It's not. You can get that fixed. You should not. Normal women should not have, it's not a normal thing. You with me? It's very common. It's very common. Yes?
What if it's like 10th of the month and you laugh?
It should not make a difference, truthfully. Now, if we're differentiating between urine and blood flow.
Yeah.
Okay, so if you're laughing in the blood flow, that's fine.
Okay.
That's fine. I'm talking about urine. I'm talking about urine. Yeah. Are you with me, friends? Got the conversation going. That's good. Okay. There are physical therapists who deal with it. Mrs. Reinhardt, Mr. Reinhardt's wife, the practice that I don't even know if she's still there anymore, but she was a specialist in this kind of women's health is what they call it, because mostly it's women who have these kind of issues. And there are exercises that you do to help strengthen those pelvic floor muscles, and seriously, it can totally cure it. Yeah, it's a whole. It's a very cool area of therapy, to be honest. Yeah, sure. From a number of different things. It can be posture related. It can be some traumatic pieces. There's a lot of things that address it. Yeah, it can be congenitally. Maybe something didn't form quite right when you were born. Yeah. Good. Slightly off topic, but a good topic nonetheless. Please. Shh. Sorry? Yes. Yes. Sure. So again, realize, so here's the vagina, right? That baby's got to squeeze through there, right? And there can definitely be trauma that happens to those muscles. So yes, oftentimes after I say often, there are times after childbirth that yes, they have trouble with these kind of things. And so again, you can strengthen those muscles back up, and often that takes care of it. But yes, many times it's after their first child that women start having these issues. They just don't ever have addressed. They just live with it their whole life. Yeah. So no, it is something that can be good. All right. So back to nerves. Can you see we have these plexuses? This is the next piece in your study guide. Plexuses are where your nerves, and I'm thinking specifically of the brachial plexus in this case. If I take you here, This brachial plexus is up here. And it's where these nerves, when they come out, it's basically C5 through T1. And they combine, and then they split, and they combine, and they split, and all these different patterns. I can tell you when I was in PT school, I remember spending hours learning all of these little splits and how they break up and come back together, and break up and come back together. You don't have to know that here. But it matters because there are 5 nerves that get formed from those splits. These guys right here. Musculocutaneous, axillary, radial, median, ulnar. These are the nerves that go to your arm, right? And if, let's say I have a problem with a disc, a spinal disc that's pinching on, let's say, C7 nerve, well, that goes to your triceps. And so therefore, as a physical therapist, I could test that muscle. And if that muscle is consistently weak, or neurologically weak is what we call it, then I know something's going on in that area. You would also have numbness and tingling if it's C7, probably right down the center of your middle finger would be numb. If it's a C8 or a T1, it's going to be the outside of your hand. Each of these nerves go to different spots in your body and innervate different muscles. Are you with me? So it's a diagnostic thing. You can use that to tell where they go, what's involved. Okay? So the plexus is this combining and then splitting and then combining and splitting. It's basically to give your body multiple ways to get a nerve signal to someplace. Yeah, exactly. Instead of just one track, and if that track gets messed up, you're toast. Does that make sense? Yes. Okay? And again, cervical plexus, brachial plexus is really what, brachial is the one that we think about the most. There's also a lumbar plexus that again is coming out the nerves to the legs. And you can see those here where you've got all these guys here. Oh, stop. You do not have to know those nerves now. Nope. All I need to know is the plexuses. Every year I go back and forth on whether you need to learn all those nerves, and I decide not to. So the plexuses, I'll just go right to your study guide. They're where the spinal nerves combine and recombine to form networks instead of continuing directly to the peripheral body parts. So in other words, instead of that one straight shot, you've got multiple routes that a signal can go to get to a nerve or to an area. Yeah. And then the examples are the cervical and brachial, lumbosacral plexuses. Okay? Uh-huh. Yes. Yeah. Because they're simply just providing some sensory to like your ribs and chest area here, as well as controlling the muscles, the intercostal muscles that do breathing. Yeah. So there's not much there.
So these plexuses, are they plexuses all the way throughout, or do they end up splitting the individual portions?
You guys, you'll see this when we dissect our cats, is that the plexus is all right here. So am I. Don't worry. It doesn't bother you. Yeah, no. Truthfully. The plexus is like all, the brachial plexus is like all in the underarm. And we'll be able to separate out all these different nerves, and then they'll actually make the nerves that go down to the hand. So the plexus is here, and then it forms into the nerves that go down the arm. The same thing with the lumbosacral. You'll have this large amount of nerves right like in the hip buttock area, and then it'll split into the actual nerves that go down. Yeah, that's the classic story of my wife coming to visit me as we were dissecting our cadaver in PT school. Because there's 4 of us to a cadaver, right? And truthfully, right, this was Marge. And we spent hours, I'm not kidding you. We had lecture from 8 a.m. to about noon, and we had lunch, and then we spent 4 hours in the lab. It was intense. And so, you spend all this time with this body. You want, this is my girlfriend. I want to come see this body, right? So she comes in, and the lab has this very distinct smell to it. It smells like Doritos, I'll be honest with you. Yeah, the bone saw. When you cut bone, it smells like Doritos. I kid you not. Like not Cool Ranch, but like the nacho cheese Doritos. That's what it smells like. craziness. So anyway, she comes in, and my wife's already, she's a little bit, she doesn't like, blood and that kind of stuff. But she comes in and opens the door to the lab, and I was with her, of course, and one of my partners is sitting, and he has Marge's arm up on his shoulder because he's working on this brachial plexus, dissecting it all out. And so it looks like, she's just there with her hand on his shoulder. And she's like, no, I'm done. She turns around and leaves the room. She never came back. Anyway, pretty funny. So that's when I think of brachial plexus, I think about my wife and Marge. All right, last but not least here.
That's large Marge, right?
That's Marge. You got it. All right, so a couple more pieces. Shh. We've already gotten through most of this. Plexuses. All right, so autonomic nervous system. Remember at the beginning we talked about there was the autonomic nervous system, this automatic things, right? And has a task of maintaining homeostasis of the visceral things without you consciously thinking about it. You don't have to say, oh, please, intestines, would you digest that lovely lunch I just had? Oh, wait, don't miss the pepperoni. I don't know why I can't lie, but I just did, right? Okay, it takes care of itself, right? So, two divisions of this autonomic nervous system. You have the sympathetic and the parasympathetic. Parasympathetic, and these are opposites, by the way. The parasympathetic is just normal. The normal, everyday, I'm taking care of business, doing what I got to do. The sympathetic is like your flight or fight reflex. Okay? When that kicks in, it's under times of stress or emergency, and like your body's ready to go. And it's a totally different, this is the I'm in danger, and parasympathetic is the I'm cool. I'm just doing my normal thing, right? There's a condition, I'm totally blanking now.
So let me get this straight there. The autonomic system is divided into parasympathetic and the sympathetic.
Yes.
And there's the autonomic and the, what's the other one?
Somatic.
Somatic. That's
The total nervous system.
PNS?
Yes. Peripheral nervous system. Yes.
There's the PNS and the CNS, and that makes up.
Central is the brain and the spinal cord. Yes. You got it. You got it. Okay. RSD. Man, I can't believe it. My mom's going to kill me. My mom has this condition called RSD, reflex sympathetic dystrophy. What happens is, in her arm is where she has it the most. It's basically like this sympathetic nervous system kicks on and won't kick off again. So the body thinks that it's always under attack. Not that she always feels like I'm stressed and under attack, but the healing processes, these normal things, don't happen as easily because it's parasympathetic is that normal, I'm taking care of business. And sympathetic is that I'm under stress, I need to release different hormones, different chemicals to do different things. Are you with me? So it stemmed from, she's had a number of accidents on her wrist. She fell at work one time, had a car kind of ran over part of her wrist. It's another story. But it causes difficulty in her using and healing on this side in particular. Okay, so that's RSD. That's the sympathetic nervous system. Okay? Good. Sympathetic, parasympathetic, and last but not least, control. Where does the control of that autonomic nervous system come from? It comes from the brainstem, from all those pieces that we talked about yesterday, all the functions of those things. That's all autonomic. That's not conscious thought, your breathing, right, and your heart rate and those kinds of things we talked about yesterday. OBKB? Any questions you want included on this recording? The test right now is Friday. Good. All right, I'm going to stop this here.